the chairman of Sierra County Older Persons Organization, which fights for the rights of older persons. Most of older persons have different types of diseases that affect them due to aging. But we have found that there are some medical facilities which cannot attend to older persons' issues regarding health. I request the hospital personnel to move nearer and some of them to be trained on such diseases so as to assist older persons. When it comes to hospital insurance, it is true government is not paying anything for older persons. Government started to identify older persons getting the fund for Wazee, and they paid for only 1 month. Thereafter, that thing got finished. But as we fight for it, the hospital, national hospital insurance is the thing that we should look into. But there is a challenge. The older people don't have children, but they stay with children who depend on them as a result of losing their parents, and more also because of AIDS. Their sons, their daughters died and left them with children. And now how can these children access to medical care through national hospital insurance? Because they say clearly that should be your child, whereas this person is staying with you. The process of adoption is very tedious. Therefore, I would advise or request National Hospital Insurance to devise a system where these vulnerable children under the care of older persons access medical care. If not, then that is medical discrimination. Another issue on health in National Hospital is they should form a committee to oversee if these hospitals, the medical providers are giving services effectively. Because if you go to another hospital, despite the fact that the money is paid, which you don't know how much, they tell you to go and buy medicine outside without rebate. There should be arrangement. In case the medicine cannot be found in that hospital, then they refer you with the sheet and that hospital pays, rather than the person who is paying for medical attention is being to pay additional money in another hospital. And I think that is a matter which requires an act of medical insurance to be amended or to be reversed to cater for this one. And in legal way, all police, we have oversight bodies, but in medical, you don't have oversight bodies. And that is why the treatment, particularly those hospitals which are targeted for providing assistance for and get money through National Hospital, they charge, but their service is very low.
Kwa jina mimi naitwa Angelina Onyango kutoka hapa Ukwala. Kitu ambayo naweza kuongea ambayo tunaona kama wazee, shida ambayo tulio nayo, tukienda hospitali, mtu kama mgonjwa, unaenda hospitali, unaandikiwa dawa, ukienda kwa pharmacy ya hospitali, wanakuambia aenda kwa chemistry. Na chemistry ukienda ni pesa. Sasa hiyo shida, najua hospitali yetu ni hospitali ya serikali na hatupati usaidizi yoyote, kila kitu ni pesa. Saa ile unaingia kwa kiwanja hospitali, Kwanza unatoa pesa, kule registration unafanya na pesa. Ukienda kutoa file ni pesa. Sasa unaandikiwa dawa, unaenda kununua nje. Sasa sijui tunalekea wapi? Wale ambaye hawana pesa, tutakufa tu maskini namna hiyo, kwa maana hakuna wenye ambayo wanaweza kutusaidia. Hiyo ndio wale wasee wanaona area yetu hii.
I'm Daniel Odipo. I'm the program officer KESPA, the main organizer of this year's World International Day of Older Persons in Siaya County. Now today, we are joining the rest of the world in celebrating or taking stock or assessing the efforts or milestones that governments have put in place to ensure the older persons access their rights and entitlements. Now, when we get back to Siaya, where we are, now an initiative has been put by KESPA, which is petitioning the county government of Siaya so that older persons can access medical services free of charge. That is requesting the county government to relieve them from paying the co-sharing in the public hospitals. Now, cash transfer has also been a milestone, though this one we can't celebrate alone. It is something that the Kenya government is also providing, and it is being done elsewhere for all older persons who have attained the age of 70 years and above under Inua Jamii program. Now, as an organization, we appreciate the government effort in supporting us through infrastructure.